Well, I've dealt with medical doctors for 3 years. I've had liver failure, prostate cancer. I've had the surgery for the prostate cancer. Uh, I have HE, I'll try to pronounce it for you, hepatic encephalopathy, which is a disease, bacteria caused from my liver failure. Creates a bacteria in my brain that eats my brain. And I also have pancreatitis. And so I've been dealing with the medical doctors for just about exactly 3 years now. And they told me on April 17th, 2011, that I had less than 2 years to live. So they were prepping me for the transplant program. But I also had the prostate cancer. And so it's kind of, they don't really do prostate surgery on you if you're a terminal patient. But where I was trying to get on the transplant list, they did agree to do the prostate cancer surgery. I had the seed implants at the Huntsman Center in Salt Lake, and that went really good. They thought that was the only procedure that I could survive at that time because I was so sick. So they did the seed implant, and I have to tell you, the 2 nights before the operation, my daughter and my wife got on the computer and saw what the procedure was going to be, and so they wanted me to back out because they said I didn't have a very good chance of living through the surgery. But I told them I needed to get rid of the cancer, and so we went ahead and did it, and as you can see, I survived the surgery. But I was down to about 130 pounds at that time. And so I just been fighting with that and trying to get on the transplant list, but because my cancer spiked about a year after the surgery, then they dropped me from the transplant list on the VA did. So my cancer doctor got me involved with the University of Utah. And so I got in their transplant program and have done various tests and been down there several times. And they found that I was losing pressure in the right side of my heart. And so I got involved with the cardiology department, and I did an echo stress test, and that's how they found that I was losing pressure. So then I did a catheterization procedure, which is where they put a catheter in my jugular vein and put a camera down into my heart to see if possibly I had a bad valve or my blood veins weren't working right. But it came out negative on that, and they said that the whole problem was my liver. So then I'm back to the transplant, and I've read all about the procedure. I've had 3 years of dealing with it, and it's a really hard surgery to survive and to have, and the percentages are not that good. And so my wife and I decided we really didn't want to go that route, and my sister-in-law brings her daughter here to Dr. West, and so we thought we'd give him a try. And this is my 4th week, and basically what my symptoms have been through this whole thing since my liver failed is I basically had the flu every day of my life for the last 3 years. And so when I came here and they told me what they could do, and I got excited, and why not? I hadn't had anybody tell me any other thing other than the transplant surgery, and which we are not going to have. Just checking into it, and I've read 2 books about it. And so anyway, we came and saw Dr. West, and he said he could help me. And to tell you the truth, after the first week, I was a little skeptical. And after the second week, I still wasn't feeling good. And Dr. J came and talked to me and gave me some pills because I've been nauseated for 3 years. And so I took the pills. And then the third week, it would be my 5th IV, I kind of started feeling a little better. And actually had one good day. And then after my second IV, the third week, that was on a Thursday. I slept most of Friday, but I woke up without nausea on Saturday morning and felt good all day Saturday and thought, well, I'm having a good day. But I have not had the nausea since that day, and that's been over a week now, and I've felt basically the same every day. Good. I don't have the flu symptoms. I don't have the nausea. So I'm amazed, and I'm really not skeptical now. I just hope that it just stays this way, that I don't get the nausea and have the flu come back. And Dr. J said that I won't. So basically I'm putting my trust in him, and so far I'm really happy with what's going on.
Have you been back to a medical doctor to get your liver checked and see if there's anything that shows up?
I have not. I just got a letter in the mail yesterday, as a matter of fact, to have my labs done, and I am to have a checkup, and then I also have varices, so I have the oral scopes done, the EGDs. I've had 9 of those done in the last 3 years, and I'm up for another one of those in June, which are totally obnoxious. And every time I have one, I'm sick for about 2 to 3 weeks, sicker about 2 to 3 weeks after I have them. And talking with Dr. J, he said possibly I won't have to even have that done anymore.
So you're filled with hope.
I'm filled with all kinds of hope. I've had more than one doctor tell me that it's a miracle that I lived through what I lived through, and to be alive right now. I've had more than one doctor tell me that I'm a miracle to be alive today. And this is the only good results we've had from anything that I've had done, any procedure that I've had done. And I've had over a dozen procedures done, and a couple surgical procedures, that is, and a couple surgeries also.